I'm John McCann with a Closer to the People update. I'm with Karida Giddings. She's the Access to Healthcare Program Coordinator for North Carolina Black Alliance. And you've been crisscrossing the state with the Our State of Health tour. What is that about and how's it been going?
So our State of Health is all about focusing in on what's going on with healthcare access issues in our rural communities in North Carolina. In particular, we're having educational updates about what's happening with this big, not so beautiful bill and how it's going to affect healthcare access. We talked about some of the good things that are happening, like the medical debt relief program, which is going to help a lot of low-income North Carolinians who may be struggling with medical debt. Did you know 1 in 5 North Carolinians struggles with medical debt?
Okay.
And has debt in collections, actually. And so this bill will offer relief, but unfortunately there are other burdens being put on our communities, and so we were having conversations about that, as well as capturing some stories, some testimonies. And so the goal really is to paint a broader picture of what is our state of health, our being Black and brown communities' state of health, especially in our rural communities that typically hit the hardest. So.
It is September. That means it's time for Rooted in Wellness. This is the 4th iteration of it. Give us that information and how folks can get plugged in.
Yes, so Rooted in Wellness Day this year is going to be on Saturday, September 20th, from 10 o'clock a.m. to 3 o'clock p.m. We've made it a little bit longer for you this year so you can enjoy more of the fun, the resources, and the panel discussion or town halls as we're trying to present to people. We know there's a lot happening with policy in our communities. It's affecting healthcare, it's affecting food access, it's affecting everything that matters most to our communities. And so the goal of those discussions are really to make sure that our communities know what's going on, but they're also hearing from trusted leaders and advocates in their communities. So we'll be at 8 different locations this year. You can catch us in Anson County, Rockingham County, Durham County, Nash County, Pitt County, Forsyth County, Mecklenburg County, and Guilford County. And so it doesn't matter where you go, just be sure to stop by anytime between 10 a.m. and 3 o'clock p.m. And I'll encourage you to use your imagination a little bit, right? I think on the surface, it does appear like a traditional health fair. But when you zoom in a little bit more and you kind of close your eyes and you see what's happening with healthcare in our state, really in our country, and who's going to be hit the hardest, I think then you'll see one of two things. You'll see a need, right? Needs that are creating gaps in access to care, access to healthy food options, lack of transportation, just to name a few. The second thing I think you'll see is who stands in those gaps. And who stands in those gaps are our churches, other nonprofit grassroots organizations, our neighbors who know our stories almost as well as we do. And so it's really a broader campaign to raise awareness about what we can be doing to stand in the gap for Black health and wellness, but also to make sure our communities are getting what they need, maybe in a one-stop shop fashion. So there's a range of different health screenings, educational resources. I know in Durham, they break their site up into different zones. So they have like a cancer education zone. They have a food and nutrition awareness zone. So you can get a little bit of everything. And I think that is the vision, is to make sure that our communities are getting everything that they need and more.
Really just sounds like a one-stop shop for all things health. It's also back to school time. You've seen those yellow buses, and I've been caught in some of the traffic already. But Karida, as we think about going back to school and we think about healthcare, give us some tips to help parents. You know, again, the school year's already started, but it's never too late to get on a good habit. Give us some health tips in terms of eating, in terms of sleeping, to help those young people show up to school as their best selves.
Yeah, so sleep is very important. I recommend making sure that kids get at least 8 hours of sleep. That is very hard with the devices that shine this big, bright blue light in our face almost at all hours of the day.
Yeah.
So making sure that you're getting a good night's rest and putting the phone screens down. The other thing is making sure that you have some kind of nutrition to start your day. Hungry kids can't learn. And so it's really important, whether it's like an apple or granola bar or something, just making sure that kids aren't going to school hungry. I think if there are any families that may be struggling with food security and they're not sure where to go, schools can be really good resources for programs that help to also fill gaps in resources that kids need. And I think that's even more important now than ever, as a lot of the cuts that we're about to experience will affect food access as well. And so from that perspective, I think there's a role for parents and teachers to play in that. Parents doing what they can. Nobody's a miracle worker, but doing what they can, right, to make sure that their kids have something to eat while they're at school. I think that will help them to be a little bit more attentive. But for teachers, I think their role is just exercising empathy, right? I think instead of jumping to conclusions about why a kid's not paying attention, why they may be disruptive, maybe think about what's going on at home. Did they get enough sleep that night? Did they have to get up a little extra early because they're not just a student, they're a sibling, they're a child that kind of like steps in sometimes in roles that adults play too. Maybe they didn't get anything to eat. So there's a lot of different factors that go into, I think, kids having healthy learning environments. I think it starts at home, but it continues in the classroom.
Well, that being said, Karida, I mean, you mentioned, we talked about rooted in wellness. We talked about our state of health. Are you taking your own advice and able to get some rest and able to get some good nutrients? Because you're doing a whole lot, Karida.
I try. I do try to get the sleep schedule down. I probably don't get 8 hours. I may get somewhere between like 6 and 7. But I do put the phone screen down. So in that regard, I am following my own advice. I do try to have like a coffee and some fruit, like I like blueberries or apples in the morning. So I'm doing what I can. But the hard part about loving what you do is sometimes it's just hard to step away and do the things that you have to do to take care of yourself too. So I will take that as a reminder to make sure that I'm fueling myself while I fuel others.
She does indeed love what she does. So take heed to her advice, and we'll see you the next time on the Closer to the People podcast.